lack of sleep or not getting enough sleep affect your mental health, the risk of anxiety, depression, or social interaction problems, things like that? Does it have any bearing on that?
That is a very good question, an important one, Ahmed. Lack of sleep is linked to psychiatric diseases. Unfortunately, this is a fact, and it's a bidirectional traffic. It's a problem that lack of sleep leads to more anxiety, so it's like a vicious cycle, and that anxiety leads to more insomnia problems. Studies over studies have shown that if you are not getting enough sleep, you are more prone to have about tenfold increased risk of depression and anxiety. And that is where it comes that there are certain medications which are used to treat depression or anxiety, which also hit the insomnia problem. So it's really important to bring that as one of the symptoms of your psychiatric illness could be insomnia. Most of the time, this is what we see, and treating and telling your doctor, your physician, be it a psychiatrist or a sleep specialist, about a coexisting psychiatric problem or a coexisting sleep problem, if you are seeing them for a psychiatric issue, would help them treating them, because treating your anxiety would help with the quality of sleep, and treating your depression may help with the quality of sleep, or the other way, treating your insomnia may help improving the symptoms of your depression or anxiety.